Your mom just got discharged from the hospital. They said she's medically stable. They handed you a packet of papers, and now you're sitting in the car in the hospital parking lot, and you're thinking, what do I actually do now? Because this is the part that nobody really prepares you for, because the surgery went okay. The fall wasn't as bad as they thought. The infection cleared up great. But now you're looking at your parent and you're realizing something that you've probably been avoiding for a while. You're thinking she can't go back to the way things were before, at least safely anyway. The hospital gave you 48 hours to figure out what to do with the rest of your life. So I want to walk you through exactly what happens in the next 72 hours after your parent is discharged. Not theory, not here are some things to think about. I'm talking hour by hour, day by day, what to ask, what to watch for, stuff that the discharge planner probably didn't tell you. Well, welcome back to my channel. If this is your first time here, my name is Winston One, currently studying for my certified in long-term care designation, my Georgia life insurance license, and I'm in the process of acquiring an assisted living community right now. So I'm deep in this world every single day, both the operational side and the financial side, and quite honestly, the human side as well. And if you're caring for aging parents or at least planning ahead for your own care, hit that subscribe button. We're building something special here, a community of people who refuse to be blindsided by the care system. And everything that I'm about to share with you today is the stuff that I wish more families had laid out for them before they hit this moment. Okay, let's jump right in. So here's what most families don't understand about hospital discharge. When the hospital tells you that your parent is medically stable and ready to go home, that is a clinical determination. It is not a statement about whether your parent can actually function safely at home. These two are completely different things, and the system treats them like they're the same. So according to the Agency of Healthcare Research and Quality, almost 20% of hospital discharges in the elder space are readmitted within 30 days. Think about that. 1 in 5, right? And a huge amount of these readmissions, they happen because the transition at home was a disaster. The care plan didn't account for what families were actually walking into. So let me give you a timeline, okay? The first 24 hours, let's call this day 0 through 1. This is your triage window. Before your parent leaves the hospital, there are questions that you need to ask. And I mean, you need to demand answers to, okay? The first one is, was this admission classified as inpatient or observation? So this is critical because if your parent was on observation status, then Medicare Part A does not cover skilled nursing care afterward. That's right. Your parent could have been in the hospital for 3 full days. And if there were 3 full days technically under observation, Medicare will not pay for rehab at a skilled nursing community. Okay? The rule is called the 3-day inpatient rule. Your parent must have 3 consecutive midnights as a formally admitted patient for Medicare Part A to kick in for post-acute care coverage. And a lot of families don't find this out until they get a bill for hundreds of dollars a day afterwards. So please, please, please ask the discharge planner directly. Was my parent formally admitted as an inpatient and on what date? You should probably get that in writing as well. The second question for the first 48 hours is, was this discharge, what does this discharge plan actually include? So a discharge plan is supposed to outline the medications. It's supposed to outline appointments, home modifications, referrals to home health or skilled nursing. What it actually looks like in reality is a printout that nobody explains, right? It's a list of numbers to different agencies that all have 2-week wait lists, and it's a pat on the back, right? That says, at it, you'll do great. Now, you need to sit with someone, ideally the discharge planner, a social worker, whoever, and you need to say, please, walk me through what my parents' day looks like tomorrow. Who is helping them get out of bed? Who is managing their medication? Who is checking on the wound, the incision, their mobility? If you can't get answers to those questions in the plan, then the plan isn't done yet. And this is where I need to tell you something that might sound a little bit uncomfortable, but you have to know, you have the right to push back on the discharge timeline. So if you believe your parent is being discharged into an unsafe environment or unsafe situation, sometimes you're just not prepared yet, right? You can file what's called a fast appeal. It's through the Quality Improvement Organization. That's QIO. Every state should have that. Right. So Medicare requires that hospitals give you written notice of your right to appeal before they discharge you. Most families don't really know that this exists, right? I didn't know it existed until I started studying post-acute care transitions as part of what we're building here at True North. But filing this appeal, it doesn't necessarily guarantee that your parent will stay. It just triggers a formal review process within 24 hours. And usually that buys you enough time. Sometimes, honestly, in this process, the most valuable thing that you can have is time. Okay. So now that was day 0 to 1. Let's talk about day 1 to 2. This is your assessment window. If your parent is going home, the first 24 to 48 hours at home are when you get to really see what's going on, right? Not what the hospital assumed, not what your parent told the doctor before they got discharged because they wanted to sound fine. The real picture. Here's what you're actually watching for, right? Can they get out of bed? Can they go to the bathroom? Can they manage their own medications? Not just swallow them, but like remember the schedule, right? Open bottles, keep track of what's new versus what's old. All of these things are necessary. Can they prepare food? Or at least can they get the food that has already been prepared for them, right? Is there a fall risk in the home? I'm talking rugs, stairs, poor lighting, grab bars, things like that. Now, real quick, I'm not a clinician, so anything specific to your parents' health needs to go through their doctor. What I'm giving you is an operational viewpoint of what families typically walk into after discharge. The research from the Journal of American Geriatric Society says that fall risks increase significantly in the first week after hospital discharge, especially for older adults who are immobilized during their stay. I think what a lot of people don't realize is that our muscles atrophy really, really fast. For somebody that's 70 or 80 years old, 3 days in a hospital bed can undo weeks of mobility in somebody in that stage of life right now. So during that window, you're not just helping. You're genuinely doing an assessment. And I know this is hard. I know it's going to be mentally taxing. I know that your parent is going to tell you that they're fine, and that's what parents do. And it's okay. But you need to look around the corners. A lot of families that I've talked to about this and studied and done interviews with, they kind of describe the same thing, right? Mom or dad insists that everything is okay because they don't want to be a burden. And I want to tell you that like that's love talking, right? But love doesn't change the fact that the kitchen still has a step that she can't see at night, right? That the bathroom does not have a single grab bar, so she's more prone to fall, right? And this is the exact moment that I actually want to just pause, and I want to encourage you to take a minute or two and take our care assessment quiz. So what we did is we built this for people in this exact specific situation. So when you're looking for your parent after a hospital stay, there's things that you need to know. So I went ahead, and if you're not sure if this is something that you need extra help at home, et cetera, what I did is I built a assessment. Go ahead and take that. It's in the description right now, or comment the word quiz and I'll send it directly to you. But this is something that I always want to add into this conversation is you never know whether you're going to need extra help and what type of extra help it's going to be, right? So whether that's going to be home health visits, skilled nursing, or full-blown moving to an assisted living community. And now you don't have to guess, right? You can just comment quiz. I'll send that directly to you and you'll be able to find out where your parent potentially is in this stage. Okay. So day 2 into day 3, let's talk about that because I think this is your decision window, right? By now you've seen the real situation. You've watched your parent try to function at home, or you've been in a skilled nursing community for a little bit and you're starting to realize that the 20 days that Medicare covers, it's probably not going to be enough. They're going to fly by a lot faster than you think. Trust me on this. So actually, let me break this down because this part catches people off guard a lot. So if your parent qualifies, meaning that they've had 3 inpatient nights, remember the difference between inpatient versus observation, and they need skilled care afterwards, Medicare Part A will cover the first 20 days at a nursing community or a rehab at 100%. Okay? The first 20 days, 0 to 20. Day 21 to 100, now your parent is responsible for daily co-insurance. So in 2026, that number was close to $220 per day. Per day, $220. Let that sink in. That's almost $6,500 a month. Now, after day 100, Medicare is going to pay nothing, 0. And once again, real quick, I'm not your licensed insurance agent yet. So nothing I'm saying here is a recommendation to buy or not buy a specific policy. This is largely just education on how the coverage actually works, right? But for your family's specific situation, I'd recommend talking to a licensed professional in your state. But I want you to think about this, right? If you're sitting here thinking that Medicare's got you and you're going to be okay. Please hear me. You are going to be on a clock. Nobody at the hospital is counting down that clock for you. By day 21, you're going to be on the hook for $220. By 101, you're going to be on the hook for this thing by yourself. So there are policies in place like long-term care policies or life insurance policies with long-term care riders. Please look into this information. This could help people pay for these services. And if you want more information, go ahead and comment calculator, and I'll actually send you a calculator to do an analysis to see how much assisted living would cost in your area and what are some of the options that you have to go ahead and pay for that. Okay. Now, if we go back a little bit, right? We talked about day 0 to 1, day 1 to 2, and day 2 to 3. By day 2 to 3, you really need to be making a decision about what the longer term plan is here, right? And there's really only 3 paths, and I'll just be fully transparent. Plan 1 is you go home with some support. So this can mean home health aides. This can mean visiting nurses, adult daycare programs, meal deliveries, medical alert systems, et cetera, right? Medicare is going to actually cover some of that home health service if your parent is homebound and they need that skilled care. Now, keep in mind, homebound has a specific definition. It doesn't just mean that they prefer to stay at home, right? And Medicare home health does not cover 24/7 care. So you really still have to worry about that. It covers skilled visits only. Like a nurse comes, checks vitals, does their wound care, and then they leave. And if your parent needs somebody there around the clock, then you move to the private pay or Medicaid. And just so you know, the average cost of home health aides in the US right now is about $30 to $35. So you could do the math on what, 18 hours of that or 12 hours of that might look like. Now, path 2 is a skilled nursing or rehab and then reassess. And this is the most common post-hospital path. So your parent is going to go to a skilled nursing community. They're going to get physical therapy. They're going to get occupational therapy. And when they're plateauing, meaning that they stop making some measurable progress, Medicare is going to stop paying. And that plateau could come at day 14. It could come at day 60. You don't really know. So you need to be asking the therapy team every single week, like, yo, where are we? What's the trajectory? What's the plan when coverage ends, right? You need to know these types of questions. And then the last option that you have, path 3, is to just full out move to an assisted living or a memory care community. And I think sometimes the hospital stay is the event that really makes that clear. If your parent needs a level of daily support at home, if they need home modifications, if they need weekly nurse visits, like all this stuff, it's not, if you're not able to cover that, and that's okay. That's not a failure, right? You're not abandoning your parent if you're not able to cover that. In many African cultures, me specifically, so I'm Nigerian, but I've seen this in my Ghanaian friends as well. There's a deep expectation here that family takes care of family. And that makes sense, right? But I would challenge this by saying that, like, while I grew up on that mentality, and I don't want to erase that mentality, I love my kids so much, but I'm not their dentist. I love my kids so much, but I am not their pediatrician or their preschool teachers, because there are people that are actually qualified for this. They go to school for it. And I feel like the same thing should apply to us taking care of our parents, right? I believe that taking care of your parent means finding them a community and qualified caregivers that can actually provide what you physically cannot provide. Like, think about it. You're working a full-time job. You're raising your own kids. That's not wisdom. Here's what I want you to understand. You're not failing your parents by putting them somewhere that's going to be able to take care of them. The only time that you'll be failing your parents is if you fail to plan. So once again, please do not fail to plan. Please know that the next 72 hours in this window, the 72-hour discharge window, the system is not designed to make that easy for you. And I don't say that to scare you. I say that because it's true. Once you accept it, you kind of stop waiting for people to hand you a plan, and you can start building one for yourself because it's inevitable. Think about it this way. The hospital is incentivized to discharge you, to charge you up and then discharge you. The insurance companies are incentivized to limit the coverage days and limit what they'll actually pay for. And then the skilled nursing community is incentivized to fill beds and get the people in and get people out quickly. So none of these incentives are really aligned with what your family needs in that specific moment to feel safe and supported. So finding that alignment is on you. And I think that's really the heart of what I'm building here at True North. I believe that families deserve a guide through this process, not just a discharge package. So let me land this here, right? If your parent just got discharged, or you think a hospital stay is coming, a surgery, a procedure, anything of the sort, here's what I need you to do right now. One, find out the admission status, inpatient or observation. Get it documented. Two, get the discharge plan in writing. Make sure it actually accounts for what your parents' daily life looks like, not just their lab results. Three, do an honest safety assessment. Within that first 48 hours, you need to watch. Don't just ask. Four, know your Medicare timeline. 20 full days of coverage. Day 21 to 100, you're at $220 a day. 100 and plus, you're at nothing. You got to plan for that. Five, if you're not sure what level of care your parent needs next, take our free assessment. It is 2 minutes. It will give you a clear starting point instead of you having to guess. Comment quiz below and I'll send it directly to you. This is the stuff that nobody talks about until you're in the middle of it. And by then, you're making decisions with no sleep, no information, and a whole lot of guilt. You deserve better than that. And your parent deserves better than that too. Once again, I'm Winston 1A. Thank you for being here. If this helped you, share with someone who's going through this right now. They may need it more than you know. Other than that, I'll see you on the next one. Peace.